It's a topic that we've been discussing for a long time, the state of mental health in our country. And right now, it's at an all-time low. And now some people aren't turning to a therapist or psychologist. Instead, they're turning to AI, artificial intelligence.
Sam. You have got my attention because you know I won't even have an Alexa in the house. But with everything related to machine learning, there are pros and also cons. So let's sort it out. We called in an expert to give us the human perspective on your AI doctoring experience.
Absolutely a thing, and we got Dr. Shannon Bennett here to talk about it. She's the Associate Director of the Center for Youth Mental Health at York-Presbyterian. Dr. Bennett, we are so happy to have you here because this is this is so timely. This is so right now. What are actual mental health providers thinking about this trend where people are going to AI as their therapist? Are they concerned about this?
Well, thank you so much for having me and for highlighting this important topic. As doctors, we know mental health in this country is at an all-time low.
Sure.
People are anxious and depressed, and that access to care is not always easy. So anytime someone is seeking support, that's a good thing.
Exactly.
We want to make sure they are seeking support that is research supported and has some guidelines or guardrails. So we know what's going to be helpful, and we can also inform people of the risks that may be present or ways that it could be harmful or unhelpful.
All right, so let's cite a study here, and I want to read this to get it right. There was an interesting study from researchers at Dartmouth, right? And they gathered a group of people with conditions like depression or anxiety. Half of them worked with AI therapy bots. They showed significant improvement, according to this. Compared to the ones who didn't, there's clearly at least, I guess, a passing or some kind of value in this. Can you help me understand that?
I think there's absolutely value, and what's really great about this study is they spent hundreds and hundreds of hours training the TheraBot in research-supported, evidence-based therapies like cognitive behavioral therapy. So, and there was the possibility of human intervention. So the safety of these research participants was being monitored.
Okay.
If someone was to say that they were at risk of harming themselves, or to share information that a child was being harmed in some way.
Right.
Those are critical times that a therapist has to intervene.
Go ahead.
No, I was just going to ask because I'm curious. Okay, so the AI now is at a level that if you say something, it can respond to you and give you an appropriate answer or not. But there are other things that humans look at. The therapist is looking at. I've been to therapy. They're looking at how you're sitting and how.
Good for you, by the way.
Right, and and are you trying to hide your response? Right?
That's absolutely true. So there is some helpful interaction that people can feel supported. They can learn skills. They may set goals and go practice. That's all wonderful. But there are important things about human interaction that are practiced in therapy. Eye contact, even silences, pauses in conversation are really an important part of the process.
Wait, you touched on this momentarily, and I want to bring it back up because there's a reason why people are turning to AI, right? You said it, accessibility. And I know so many people who are in need of someone to speak to, but their insurance doesn't cover it, or they can't afford it out of pocket.
Boy, this is a great, you're going someplace great.
More accessible?
So we all want mental health resources to be more accessible. We need more resources supporting healthcare and mental health care. At the same time, we do want people to understand that there are resources available that are low fee, low cost, either covered by insurance. There are other agencies that can support or subsidize care. So it's important. It may not be as easy as a click of a button, but we do want to invest in finding the right care for each individual. So personalized health care. This is an important part of research for AI. How do we know what will work best for whom? For some people, this may be a really helpful place to get skills and support.
It's just, I just think that also your therapist, you have conversations that can understand your background, where you've been, the experiences in your life. I'm just curious if AI can keep up with that.
Well, AI starts to build memory on you. So it's very interesting, but we don't want it to replace an actual doctor.
I think it's an important tool in our toolkit. It can augment and extend what trained doctors are doing, and we want to do more research so we can harness the opportunities and also be very, very careful about the risks and know for whom those may be most important.
This was a great conversation.
Fascinating topic. Dr.
I didn't expect.
Thank you for joining us.
Thank you so much for having me.